Stigma is a silent killer. It lurks in the shadows of our society. It whispers lies into the ears of those who suffer. Mental health stigma is a heavy burden. It weighs down on countless individuals every day. This invisible force shapes our world in profound ways. It influences how we think, feel, and act towards mental illness. The stigma surrounding mental health is deeply ingrained. It's woven into the fabric of our culture. We see it in the way people speak about mental illness. We hear it in hushed tones and cruel jokes. It's present in the media we consume. It's reinforced by outdated policies and practices. This stigma tells us that mental illness is a weakness. It suggests that those who struggle are somehow less than. But stigma is not an immovable force. It's a construct of our own making. We have the power to dismantle it. We can choose to challenge these harmful beliefs. We can create a world where mental health is valued. A world where seeking help is seen as an act of courage. Where compassion replaces judgment. Where understanding triumphs over fear. The journey to break these chains begins with awareness. We must shine a light on the darkness of stigma. We need to expose its harmful effects. We must recognize how it limits our potential as individuals and as a society. Only then can we begin to create meaningful change. Only then can we build a world that embraces mental health as a fundamental part of human experience.
Section 4. Media's double-edged sword in shaping perceptions. The media wields enormous power in shaping public perception. When it comes to mental health, this power can be both harmful and helpful. For decades, media portrayals of mental illness have often been negative. They've reinforced stereotypes and spread misinformation. Movies and TV shows have depicted those with mental illness as dangerous or unpredictable. News coverage has sometimes sensationalized mental health issues. These portrayals have a real impact on public attitudes, but the media also has the power to challenge stigma. In recent years, we've seen more nuanced representations. Some shows and films are exploring mental health with empathy and accuracy. Celebrities are speaking out about their own experiences. These stories help normalize conversations about mental health. They show that mental illness can affect anyone. They demonstrate that recovery is possible. Social media has created new platforms for discussion. It allows people to share their stories directly. Support communities have formed online. These spaces provide connection and understanding. But social media also has its downsides. It can spread misinformation quickly. It can create echo chambers that reinforce harmful beliefs. The challenge is to harness its power for good while mitigating its potential harms. The media's role in shaping perceptions is evolving. We're seeing more responsible reporting on mental health issues. There's a growing awareness of the impact of language and framing. Media literacy is becoming increasingly important. As consumers, we have the power to demand better representation. We can support media that portrays mental health accurately and compassionately. By doing so, we can help shift the narrative around mental illness.
Section 5. Empowering change through education and advocacy. Education is a powerful tool in the fight against stigma. It has the power to challenge misconceptions. It can replace fear with understanding. Mental health education needs to start early. It should be part of school curriculums. We need to teach children about emotional well-being. We need to normalize conversations about mental health from a young age. For adults, ongoing education is crucial. Workplaces can play a key role in this. They can provide mental health training for employees. They can create policies that support mental well-being. Healthcare professionals also need continuous education. They need to stay updated on the latest understanding of mental health. This helps ensure that those seeking help receive compassionate, informed care. Advocacy goes hand in hand with education. It amplifies the voices of those with lived experience. Advocates push for policy changes. They challenge discriminatory practices. They work to ensure that mental health is given the same priority as physical health. Advocacy can take many forms. It can be as simple as speaking up when you hear stigmatizing language, or it can involve organizing campaigns and lobbying for legislative changes. Personal stories are powerful tools in education and advocacy. When people share their experiences with mental illness, it humanizes the issue, it challenges stereotypes, it shows that recovery is possible. These stories create connection and empathy. They inspire hope. By sharing our own stories, or by listening with compassion to others, we all become advocates for change.
Section 6. A call to arms. Building a compassionate society. The fight against mental health stigma is not someone else's battle. It belongs to all of us. We all have a role to play in creating a more compassionate society. Every conversation we have about mental health matters. Every time we choose empathy over judgment, we make a difference. We are all capable of being agents of change. Building a stigma-free world starts with self-reflection. We need to examine our own beliefs and biases. We need to challenge our assumptions about mental illness. This isn't always easy. It requires courage to confront our own prejudices, but this inner work is essential. It's the foundation for creating wider change. Community action is crucial in this fight. We need to create spaces where people feel safe to talk about mental health. This could be support groups, community events, or online forums. We need to advocate for better mental health services in our local areas. We can volunteer with organizations that support mental health. Every action, no matter how small, contributes to the larger goal. The journey to end mental health stigma is ongoing, but there is reason for hope. We've made progress. More people are speaking out. Attitudes are slowly changing, but we can't become complacent. We must continue to push for change. We must keep having difficult conversations. We must keep challenging stigma wherever we encounter it. Together, we can create a world where mental health is understood, valued, and supported. A world where no one has to suffer in silence. A world where compassion triumphs over fear. The power to create this world lies within each of us. Let's use it.